So, Lupita Nyong'o has been in the news recently talking about her diagnosis with fibroids. So I thought it might be a good time to just come out here and give an overview of fibroids. So what are fibroids? Fibroids are non-cancerous growths that happens in the womb. It's very common in women in their reproductive age, ages of 16 and 50. About 2 in 3 women develop fibroids between the ages of 30 and 50. What causes it? The exact cause of fibroids is not known, but there are known associations. For example, it's very common in obese women, and this is because it's been linked to estrogen. Estrogen is the female reproductive hormone, and its production is increased in women who are obese. It's also known to be higher in Afro-Caribbean women. We don't know why, even though there are studies coming out suggesting that it could be linked to chemicals in hair relaxers. Next, I would love to talk about what symptoms could indicate that a woman has fibroids. But before I say that, I would love to add that it's less common in women who have given birth, and also it shrinks after the menopause because there's no more estrogen to feed it. What symptoms could alert you that you might have fibroids? So sometimes fibroids are asymptomatic, which means that they don't have any symptoms at all. But other times it could cause things like very painful periods, very heavy periods. It could also cause needing to urinate frequently, pelvic pain, abdominal pain, constipation, pain during sex, etc. Like I said, it could be asymptomatic as well. And what's the treatment? So when it's not symptomatic, usually no treatment is required. But when it starts to cause problems, you need to see a doctor to diagnose it. And how do you diagnose it? The diagnosis is usually through history, where the doctor will speak to you about your reproductive history and symptoms, and then examination. In some people, you can actually feel the fibroids when you examine their stomachs. And then, but the definitive way of diagnosing it is through an ultrasound. So your doctor may also request that for you. So if it's not causing any issues, we leave it alone. But in most people, it tends to cause things like the things I've said earlier. And how do you treat it? So you could just try and control the symptoms, like pain medications that reduce the heavy flow, or there are other specialized medications like hormonal medicines to try and shrink it. And depending on where it is in your womb, surgery may be suggested and the symptoms you're getting. I hope this helps. Till next time.